here on the end, Tricia being chemotherapy, right? And she was just so envious of all the attention we were getting. She decided to join us.
That's all the way.
That's all the way. And I just want to say thank you to each one of you, right? Because the work you do, right? It might need, you know, sometimes it doesn't mean anything to some people, you know, but to a woman sitting on a chair who has basically been given a life sentence and she doesn't know, you know, what's going to happen. And the kind words and just the little things you do, and that's why we wanted to do this thank you back tonight. Just to say, lads, well done, and keep doing the work you're doing, and we have a lot more people coming along the road behind us, and we're going to be there for them, right? And together we are going to fight this, you know, and I'm just so humbled and so honoured to have made amazing friends in the group. Now Jo has my head wrecked. She's one of the most demanding women you've ever met in your life. Excuse me. But all I'm saying is, the girls' club is about being there for each other, right? Nobody set up this group. I didn't set up this group to get slaps on the back and Regina, you know, you don't do this work or you don't do this work to get awards or anything like this. We do this work because when cancer comes to our door, right, as a woman said to me during the week, oh, she said cancer is like a cold, everybody's getting it. A cold and cancer are two totally different things. But, you know, when people talk to you, they don't know what to say to you, you know, and we have to respect that as well, because, you know, they really do. Like I was on TV3 a few months ago and I said, come into the centre and we'll teach you how to talk to us, you know. And the basic of the girls' club is, when I signed the lease for the premises, I didn't have nada, nothing. Didn't have a penny in the bank account. And the guy who was renting it said, would you like to pay by direct debit? And I said, yeah, of course. I didn't have a bank account. I said, yeah, right? But I signed the lease before I told him the truth, because I knew I was getting this amazing premises, right? And that the door, that Linda's painted pink, a brighter than your pink, a bright and luminous pink, right? The door is always open. As I lived in Spain for many years, we always say, mi casa su casa, right? My house is your house. So that is what the girls' club is all about. And you know, we started in February 7th this year. We've got our new premises, and we haven't put up a poster because you know, girls in the different hospitals here, right? You didn't even know who we were, you know. Well, you did, obviously, but you know, you didn't know anything about the girls' club because we haven't advertised it, because we want women to come in and feel in a very, very safe, secure area, you know. And all I can say is they are two very hot guys here, right? Now, I don't know if they're interested in having affairs or not, but I am. There's certainly a way to go there. Can you put that? Do you know? He knows my name, yeah. If we had more people like Caroline here, and I've talked to her mum outside, and your mum is so proud of you, and you didn't have to take the time out of your schedule or cancel your bookings tonight to have us here. And Caroline, I swear, cheers.
Actually, in the outpatients department of the South Infirmary, I work as one of the oncology liaison nurses. Now, my colleague would normally look after ladies with the gynecological cancer, Eileen, whereas I would look after the other patients that come through the hospital. I suppose our job really is to kind of explain to people what's going to happen once they start receiving their chemotherapy, follow them up throughout their treatment to make sure they're getting on okay with it, organise any other investigations that might need to be carried out or whatever, educate them about the treatment, what to expect, what kind of side effects to look out for, how to deal with them at home. And basically we're just there at the end of the phone. We have at least number we can be contacted anywhere in the hospital with Carrie Beep or whatever. So we're always there at the end of the phone if someone has questions from home.
Hello, my name is Rosemary Highland. I'm 49 years of age. Last year, March 2010, I went into the CUH hospital for investigation surgery. I had a small lump in my groin area and I had got an ultrasound test done, and I had shown up that I had a 20 centimetre tumour on my right ovary and also one groin inside. My symptoms with ovarian cancer is that when I went to eat food, I found it very difficult to break down the food. I got a lot of discomfort, and I also felt my stomach was starting to bloat. So I actually looked like I was about 5 or 6 months pregnant, but I didn't know what was happening at the time. So I went in for the investigation surgery. I spent 2 weeks in hospital, and they were very good to me in there. I had a hysterectomy done, and I had my ovaries removed, and I had 4 tumours removed. And when I came out of hospital the following week, I got the biopsy, and they told me that I had ovarian cancer, and that I had stage 4 grade 3 ovarian cancer, and that my liver had deteriorated quite a bit, and they weren't quite sure had it reached the liver or not, so that they would start me on treatment. So I started chemotherapy in the oncology unit in the South Infirmary for 6 months. I had treatment once every 3 weeks, and I went into remission then in September. I was absolutely delighted with myself, and everything was great for a couple of months, and I started to get pain again, a lot of discomfort. I had put on a lot of weight and had taken a lot of steroids, so I was trying to lose the weight and went into a lot of pain. So May this year, 2011, I was diagnosed again that the cancer had come back, and it was now terminal. So while I was shocked at the news, they were very good to me up at the hospital, I have to say. I got the best treatment between CUH and the South Infirmary, and also the oncology unit as well. The nurses were fantastic, and my family as well. So my treatment is ongoing, and I suppose every day is like a new day for me now, and I try to be positive as much as possible, and please God, maybe I'll find a cure for this cancer. But there were wonderful nurses in the South Infirmary, like Emer here.
Hi, my name is Emer Lee. I'm an oncology liaison nurse in the South Infirmary. There are 2 of us actually in post. My colleague would normally look after ladies with gynae cancer, and I look after the other patients that come through the South. Our job really is we're not involved in actually giving the chemotherapy as such. We're not a hands-on service, we're more kind of advice and support for patients. So we kind of meet them at diagnosis, explain what's going on, what the treatment will involve, what kind of side effects and things to look out for at home. We're there at the end of the phone if somebody needs us. Between us we work, cover the days Monday to Friday or whatever. We basically try and make the journey as easy as we can for people. If there's investigations or things to be sorted out, we try and schedule them so that they're not coming every day of the week. We try and get everything done on the one visit to hospital just to make life that little bit easier. We organise the chemotherapy dates, follow up with our patients, with the consultants, and kind of thing. But basically it's more supportive than anything. It's just a trend.
I just wanted to ask you, how do you step back from from the patients, being emotionally involved, taking it home with you?
It can be difficult sometimes, definitely. I think what you kind of do is over time you sort of develop an end of the day routine for yourself or whatever. So for me it's kind of like going to the office, take off the bleep, put it on the shelf, change out of my uniform, I'm out the door.
You hold your husband.
I'm in more again.
And has there been any one case that has really touched you?
Yes, they're always, you will get that, yeah. Maybe 3 or 4 times a year there'll be someone that really kind of, because you can associate with them, they might be your own age, they might remind you of a relative, might remind you of someone that you were very close to at one stage. And then it can be more difficult, but at the end of the day you have to remember you're there as a professional support. Like everyone, as Rosemary said, people have their family and their friends at home to support them. You're there to try and make it easier from a professional point of view. So you try and, if you can, maintain that slight difference, just so that you can be more objective in your dealings.
And Rosemary, so delighted and so humbled by your amazing family, your 2 girls who I've come to know over the last few weeks.
Thank you, Anne.
Yeah, amazing. And your husband? We moved into the girls' club. The first person there was, well, we didn't move in yet, but you know, we're moving in. The first person there was Rosemary.
I was only delighted now. I was only delighted to help.
Yeah.
Where people want to
And I suppose going through the journey like you're going through, I don't know what my end result is going to be. You know, I've cervical cancer myself, and I just think I felt after you've been diagnosed with cancer and you go through the system and everybody's there, I felt it's like giving a 15-year-old a baby and saying, now take the baby home and nobody's going to tell you how to rear your child.
Yeah.
You know, so the ethos of the Girls Club is that we don't emphasise cancer. We're sick of it, death of talking about it, but at the same time you can look around the room and you can relate to somebody there, you know. And like tonight is an amazing night for all of us because we're celebrating our lives and we're celebrating like Emer, who get us through this life, this journey.
Yes.
This journey, and it is a journey.
It is a journey.
You know, it is a journey we're going through. But I want to get from you, you know, what would you say now to if a woman is in the same situation to you? What would you say, like
I think
getting
when
up
one
every
is
morning?
diagnosed with cancer, I think one of the most important things is surround yourself with positive people. As much as possible, because that's very important. And I know it's hard, but try not to worry too much. What's fantastic now, since I've joined the Girls Club and I'm learning more about Anne, which is fantastic and you're a great inspiration to us all, is that you're setting up a phone line. And this phone line will run, like you said, in the evening time for, like you say, at night time, sometimes your thoughts.
Yeah, night time is the hardest time.
It can be very difficult.
You know that,
to
Emer,
it's
for
very
dealing with
quiet,
patients.
your thoughts are playing havoc. And that is the time I find very difficult. But I would definitely say positive. You know, for me, it's probably easier because I have two girls and they are just my life. They're my absolute life, and every day I absolutely just treasure with them. And my time is short now, so it's taken on a more of a meaning. You know, and even just going for a walk down the road, you know, just looking at nature, it's just more meaningful now. You know, and
More
don't take
appreciative.
anything for granted now so much as maybe as I did before. And but definitely friends, good friends, positive as much as possible, and try and keep positive too, because you know, as Anne said, in the Girls Club, miracles can happen.
And I do believe they do.
Yeah.
You know,
Yeah.
I do believe they do. And like in the club, I know some of us have awful days. You know, we don't want to get out of bed, and we've pulled people out of bed. Oh yeah. Not pull them literally, but you know, over the phone saying, come on, get out of bed and all that. But I think, you know, and you know it, Emer, because people are going to say to you, you know, when you're dealing with cancer patients, how do you talk to them? And you know what people say to us when you have cancer.
Yeah.
And there's really no malice in it.
I know.
Do you feel?
I have to say one of the most annoying things is I look very well. I actually probably look like there's nothing wrong with me, and a lot of people say I look very well. But sometimes I might look very well, but I might not feel very well. I do think people need to be a little bit more educated about cancer, and hopefully we're doing this, or you're doing this, and we're all doing it through the documentary.
It's our club. It's the Girls Club, and you know, we'll be moving in there now in 2 weeks' time. And the first thing I wanted about the Girls Club is I came up with the idea, right? You don't do this to get pats on the back. You don't do it like, oh, she's great and inspirational. You know, I'm not into that, the lads will tell you. Hi Marie, how are you?
Hi Anne, I'm very well, thank you.
Can you tell me how you found out about Girls Club?
I met you in the Rochester Park Hotel at a fundraising day it was more an awareness day for Cúnamh. And
So if you could answer that by saying I first found out about the Girls Club when I met Anne.
yeah,
Thanks.
So it's kind of throwing things off, sorry.
No, you're fine. You're fine.
I found out about the Girls Club the day I met you, Anne. And we met at a function in the Rochestown Park, and we got chatting, and you explained what it was about. And it sparked my interest, the fun side of cancer, because there's so many wonderful organisations that take care of so many of your other needs. The fun gets lost somewhere along the line, and I think we all need a bit of fun in our lives. And it took me a while to come, because I was coming on my own. Something I felt I needed to do for myself. And it took me a while to come to the Girls Club, but once I came, that's it, I'll never leave.
God, you look amazing.
Yeah, feeling good now. The hair is starting to grow, which is a big plus, because you feel you're getting back to yourself. I'm getting back to me again once my hair is coming back.
Can you tell me the story when you were first diagnosed and the funny stories in the hospital?
Oh, I was diagnosed August last 2010, 2 years ago now, and I was cut with breast check. Very, very lucky, very blessed. It was spotted. It was in 2 places. I went in the following month and I had surgery. Then I had to go back for a second surgery, and then a few weeks later started chemotherapy, and after the chemo, radiotherapy, and I finished my chemo last November. So I'm completely through, and I'm probably cured, as my doctor said.
Fantastic. What was the reaction? You know, with cancer, it's harder for the family to look at you. How did you find that?
Yes. I was so minded. I have a husband and 3 sons and a brother and sisters, and I have fabulous friends and neighbours. But I was just minded to death. So it took a while for them. I actually very early on accepted I had cancer, and that was that, and it had to be sorted and would get fixed. But they wrapped me in cotton wool for a while, and you'd love to have a little argument, and you'd have to, you'd love to say your mind. So eventually kind of I had to stand up and kind of say, hey, I'm still me. I'm still me, stop pussyfooting around me, and then kind of we got used to it. And I'd look up and see my 27-year-old son wearing my wig on the computer, and he'd answer, this is Rapunzel's house, who's calling please, or we just had just little bits. Sporting wise, we had some American football final was on when I was in hospital getting chemo. So I used to always watch that with my sons. So we had a party in the hospital. My husband brought in the popcorn, the Pringles, the chocolates, and another patient. Not that particular night, no, but we did have a little sneaky Christmas drink in there. My sisters came up and decorated my bed, and I had my Santa hat on with my oxygen, of course. And we raised the toast to all our friends and the party that I was missing. And we said we'd make up for it next year, which we did this year, big time.
Well done, you.
So we had some good times.
What's your outlook in life now?
Oh, it's not any different.
Acceptance, I suppose.
Well, I had total acceptance from day one that I had cancer. I had huge faith in God first, but also in the doctors, the nurses, the oncologists, the surgeon. I just felt if it was my time, it was my time. If it wasn't, I was going to be fixed. I have been fixed, thank God, and I'm just doing what I normally do. I'm just carrying on. I'm doing nothing different. Trying to lose my weight, obviously, from the steroids, and trying to get my hair to grow another bit longer. You're getting well when you're worried about your face and your hair and your fat and your big hips and everything. But you're on the way when you're doing all the normal things, and I'm doing all the normal things now, and loving it.
This is the first time I met you. The change is just unbelievable.
Yeah, well, I think what cancer does is it knocks your confidence, for me personally, it was more I always thought I'd get pale and interesting, do you know, and they'd say, oh look, she's so delicate, but I didn't. I blew up from the steroids, so I looked like a blimp, and I felt totally cross with that. Nothing fitted me and that, and I kind of thought, from a person who was never very vain, but liked to, you know, kind of do my best.
No, like I didn't lose my hair of cancer, but I found dealing with all the women that I deal with every day, it's like a stigma, they say to me, because everybody knows you're sick because your hair is gone, you know, and you're in a bandana or a wig. How did you feel about that?
I totally knew I was going to lose my hair, but everybody said it comes back way thicker and stronger, and so I thought, yeah, I had great hair to start with, so brilliant, bring it on. Do you know, I'd get good hair at the end of this. I wore the wig only actually when I went out socially. At home or with my friends or with my family in their houses or whatever, I never wore my wig. I just wore it socially so that people wouldn't know I had cancer, because I wanted people to still come up to see me and to stop me in the street and say, hi Marie, how's life, you know, and then I could choose to tell them, you know, but it was mainly for other people, and so people could approach me and not stand on the other side of the road saying, right across the road, oh my God, has she cancer, has she not? What's wrong with her? And
What do I say?
Yeah. So it was more to put other people at ease than for me. But I'm very glad to be free of the wig. It was the wig. It wasn't my wig, it was the wig. It was like my tablets, the wig. It was all part and parcel of what was happening to me.
And if there's a woman or a man or anybody out there watching this, what would you say to them now?
Cancer affects everybody differently. No two people's cancers are the same. And how everybody reacts is completely different. For the way it worked for me was that I accepted it and said, okay, I've got it. What's the plan to get better? I followed the plan and I stayed positive, which I think obviously is something everybody says. But just get on with your life. You could be a diabetic, you could be this. I know that's not an easy thing to say, and maybe it's not right in some ways, but it's just accepting I have it. This is how I'm going to get better, and go about getting better. And just look forward.
Every day.
Oh, every day. Every day. I mean, I have a husband and 3 sons. The laughing that goes on in my house, non-stop. And that never stopped. And laughter really is the best medicine.
And that's what the Girls Club has taught me about, that you can have a life of cancer.
Oh, completely. Cancer is not the end of your life at all. It's something that happens to you during your life. And it's not all doom and gloom. For some people, unfortunately, there isn't a happy ending. But thankfully now the majority of people there is. And you just have to go with that. Go with your instinct and just love life, love people. Enjoy it.
And if I asked you to say just one word now, what would you say?
Happy.
Or could you tell me in your own words now, what does the Girls Club mean to you?
The Girls Club has given me my confidence back in myself. It's sharing your experiences, but in a way in which we all laugh. We all understand exactly where we're coming from, and all the embarrassing things that happen to you, that you have to do, that you have to go through, and it means giggling about them. It means fun. It means getting together. Of course, there are tears sometimes because some of us have sad stories. But for the most part, no. It's helping bring that sense of fun and confidence back, which I think can happen to a lot of people.
And we're only the caretakers now. They help the others get through it.
But I think I don't want to be, nor am I going to be a professional cancer survivor. I have survived it, it's gone, it's in my past. I am now getting on with my life, as they say, doctors did say, I'm probably cured. But we can actually all give. We can all give a little bit and we can help a little bit. And if it makes it easier for somebody to come into the club here and see me and say, yes, I did have breast cancer, yes, it was at an ugly stage, but I was very, very blessed and very lucky, and I'm fine now. And so people can see somebody who has come out the other side and who actually cancer didn't ruin my life. In some ways it probably enriched it, because that is the one thing, the depth of love that I felt from everybody. Strangers who stopped my family in the street and said, I offered up Mass and Holy Communion for your sister. I would know who they are, but they did it for me. And if I can be somebody here in this club that somebody can come up to and just maybe have a little chat, I might just make them a cup of tea. But the club is just about being there for each other.
And they're safe.
Oh, completely safe. And you're allowed to laugh and cry inside here in equal measures. But we prefer if you laugh more. That's what we're about.
Brilliant.